Thank you very much, Wolf, for your presentation. If we start with Dr. Baltimore, the IOM recommended $1 billion per year for expenditures on research on AIDS by 1990. Why do we need to spend so much money?
We need to spend so much money because it's such a complicated problem. It takes in so many different disciplines, and as I said, it involves inventing new methods of vaccine production, new methods of drug development that haven't existed before, haven't had to exist before. These are expensive matters, partly because we don't know where we're going. And so we have to take every avenue of approach that might conceivably be helpful. Also, the need for primates makes it a very expensive business because they have to be cared for carefully and humanely, but they're very necessary in trying to develop models so that we can understand the transmission of the virus. We don't actually understand the transmission of the virus extremely well in human beings at all. We know who gives it to whom, but we don't really know how. Those kinds of things could be learned, I think, only by studying primate models. So there are huge expenditures necessary. There's very expensive kinds of research necessary, and we have to bring whole groups of people into the problem who have not been involved previously, including the academic scientific community.
The administration recommends $413 million for research in '88. What is your medical and scientific evaluation whether that is sufficient?
To my mind, that's not sufficient. We were very pleased to see that the administration had recommended an increase in the AIDS budget, but our own projections, and they're not precise to the dollar, were that it would take $1 billion by the 1990 budget, and projecting that back to this budget, I would think that this budget should provide something over $500 million for AIDS research.
Do you know where you'd put the additional money?
I'd have to do a detailed analysis of where things
are,
but I think there are many opportunities where that money can be used very effectively.
There's been proposed that we have a national commission on AIDS. What would it do?
I think it would help the American public to make a continuing assessment of the developments in this area. It would help to coordinate activities between groups that have not historically been involved with each other, particularly the research efforts in private industry and the research efforts in the public sector. It would help to assess the international situation and see its relevance to the United States. We don't see it as a commission that's directing research or that becomes the conduit for research funds, but rather a kind of overarching commission that will look at the problem broadly and help people cope with what is an increasing burden on the society in so many different directions. As Dr. Wolf has said, this includes health facilities as well as research.
Let me ask Dr. Wolf, one of the knottiest problems that we face, it seems to me, is how to conduct a comprehensive education program without offending the sensibilities of many people on these delicate subjects. What's your feeling about how we ought to proceed?
Well, we discussed this in great length, and we certainly are concerned about offending people's sensibilities. On the other hand, we feel that to allow this disease to continue unchecked is much more offensive. We believe that there are means for doing this in a tasteful way, but nevertheless getting it across. We also feel very strongly that one has to be explicit, one has to say it like it is to get the groups that we're interested in reaching to understand it. Certainly, I don't want to to criticize what we see on television today, but there are some other sensitive issues that seem to be handled in very open ways in our media without offending a lot of people's sensibilities.
No problems in killings and shootings and violence on the television. And yet, sometimes there's this hesitancy in matters which can make the difference between life and death, and in terms of enormous strain and anxiety within our society on these other matters. What leads you to believe, or what evidence is there that these education campaigns, these efforts to change behavioral patterns can really be effective?
Well, there's some correlative evidence. When the gay communities...
There's what kind of evidence?
There's supporting evidence.
Fine.
There's not direct evidence. But when the gay community began very intensive local educational activities in places like San Francisco, which resulted in much wider use of condoms, associated sexually transmitted diseases such as anal gonorrhea dropped by 90% within a year. Since we know that the use of condoms will stop the passage of the virus across into the recipient, we believe that the same thing would happen. And unfortunately, those populations were so heavily infected to begin with that one could not make that kind of study. But I think that clearly the evidence is there.
You want to comment on the administration's budget figures again, in order that we have some kind of guidance as we go through this process in terms of staking out priorities?
Yes.
About $121 million.
Yes.
We recognize, as Dr. Baltimore, that we're not just talking about federal, we're talking about state, local communities, groups, business, church groups, others. But given the amount of your own consideration, the consideration of the Commission on this issue of education, are there enough resources there with $120 million to do the kind of job that should be done?
No, in my opinion. And the opinion of our panel was that the $1 billion we were asking for by 1990 was not just for advertising, not just for public education. It was for testing. It was for counseling. It was for trying to improve in some way the handling of drug abuse, not the interdiction of drug abuse, but rather the treatment of drug abusers. We heard in some of our hearings in New York, for example, that methadone clinics were oversubscribed. Drug abusers could not get into them. It cost about $3,000 a year to maintain a patient on methadone. It costs up to $150,000 to treat a case of AIDS. We think that the trade-off is considerable.
I'd ask you both on the recommendation of the administration in terms of the budget. We have this reduction in the NIH, how you cut it. As researchers, scientists who are strongly committed on AIDS, is this a troublesome factor? Are you concerned not only about the priority that AIDS has, but are you concerned about the withdrawal of funding for these other areas of research as well? Dr. Baltimore.
Absolutely. The opportunity that we have today to understand the basic cellular processes that lead to diseases like cancer, heart disease, and others, those opportunities are without precedent in history. We could be doing a tremendous amount more work today than we are. And the only limitation is funds. The scientific community consists of people very well trained and very dedicated to research activities, and really the limitation on how much they can accomplish, how much more they can learn about cancer, how much more they can learn about AIDS, how much more they can learn about the fundamental virology and immunology that's behind so many diseases is a limitation of funds. To see the administration recommending that money be taken from this year's budget and that money be, that next year's budget be even less is to me shocking and seems to me to be a total misreading of what the priorities of this country ought to be.
Do you have any comment? Well, I don't know, Dr. Wolf, you want to make?
Yes, I would. Thank you, Senator Kennedy. I would like to emphasize what Dr. Baltimore just said, what both you and Senator Weicker said before, and even more so, say I think it's incredibly short-sighted. Let's suppose that we were lucky and in 5 or 10 years we had a treatment for AIDS and a vaccine for it. There would have been precious time lost in dealing with other very important diseases. Most importantly, I'd like to take exception to one of the things that the Assistant Secretary said this morning. I agreed with many of the things he said. When he said that a cut to 5,600 grants this year would not affect new grants, I think that that's patently wrong. You cannot cut 700 grants out of the NIH's budget and not expect very disastrous consequences to the scientific community And I think those consequences will be far-reaching.
I'm sure that that's a pretty good cue for Senator Weicker to come in. I'd just ask you whether both of you believe, you're scientists, you're researchers, leaders in this area of research and education. Is there a role, would it make a difference if the President became involved in this in terms of providing leadership on it?
Emphatically, yes.
Health issue for the American people?
Yes. I think in the strongest of terms, I would urge him to take a strong leadership role. I think it would be most important.